If you are a man over 50, 60, or even 70 years old who wants to protect your prostate health, maintain ideal testosterone levels, and prevent cellular aging, pay very close attention. Today, we are not going to use euphemisms, we are not going to beat around the bush, and we are absolutely not going to shy away from the truth. Today, we are going to talk about masturbation. That's right, you heard correctly. Masturbation. Have you ever wondered whether it's normal to keep masturbating at this age or whether this habit might be silently destroying your health, draining your energy, or harming your prostate without you realizing it? If these questions have ever crossed your mind in the privacy of your bedroom, I want you to know that this video is the honest, direct, and clinically backed answer you need to hear. I am a doctor, and I want to reveal a medical reality to you right now. You are not alone in this. According to medical statistics that are rarely discussed in public, the vast majority of men continue to masturbate throughout their lives, regardless of age. Sadly, many do so under a shadow of anxiety with unjustified guilt, and most dangerously, with a complete lack of accurate information. Why are we so afraid of a natural biological function? I clearly remember one patient, let's call him Mr. Ricardo, 68 years old. He came to my office for a routine checkup, but his blood pressure was abnormally high. It wasn't due to heart disease, it was pure nervousness. At the end of the consultation, he gathered all his courage and said to me, "Doctor, I need to confess something. I still masturbate. My wife passed away years ago, and I continue doing this a few times a month. I feel like a pervert. There's something wrong with me. That's why I feel so tired." Mr. Ricardo's question reflects the feelings of millions of men out there. Society, culture, and old beliefs have made you think that masturbation is something only for puberty, and that once your hair turns gray, continuing to do it is wrong, dirty, or even harmful to your health. But today we are going to erase that ignorance. It's time to examine masturbation under the microscope of modern science, not through the prejudices of the past. Please always consult a qualified healthcare professional about your personal situation before making any changes to your habits, because every metabolism is unique. The scientific truth is this: when done correctly and with an understanding of your own body, masturbation is not only harmless, it can be an extremely powerful natural medical tool. In today's deep and detailed video, I am going to present the 10 medically proven benefits of masturbation for older men. We will talk about how it can protect your prostate against cancer, strengthen your immune system, improve your sleep, and even help keep your brain sharp and agile, all backed by studies from Harvard University and the world's leading urology journals. However, I must be clear with you. Like any physical activity, if done incorrectly or compulsively, there are risks. That's why in the second half of this video, I will explain the danger signs you absolutely must know to protect yourself. But first, let's leave shame at the door. You are an adult man and you deserve to know the truth about your own biology. Come with me. Let's dive into the first benefit. One I'm sure will surprise you. Very well. Now that we've left prejudice at the door, let's step into the laboratory. I want you to pay very close attention to these first 5 points because we are going to analyze how your body reacts biologically and why this practice is so much more than just a moment of pleasure. We'll start with something that worries almost every man as he ages: the functionality of his tool. Benefit number 1, cellular oxygenation and prevention of fibrosis. You may have heard the saying, use it or lose it. In medicine, this is an absolute reality when we talk about penile tissue. Let me explain what happens microscopically. As we age, spontaneous erections, those morning or nighttime ones you used to have when you were young, decrease dramatically due to falling testosterone levels. Why is this a problem? Because those involuntary erections had a vital function, delivering oxygen-rich blood to the corpora cavernosa, the internal chambers of your penis. When erections become infrequent, this internal tissue begins to suffer from hypoxia, a lack of oxygen. Over time, this lack of oxygen causes healthy, elastic tissue to turn into scar tissue, a process we call fibrosis. The result? A penis that becomes rigid, loses size, and, most seriously, loses the ability to fill with blood in the future. This is where therapeutic masturbation comes in. By provoking a full erection, you are forcing a massive influx of oxygenated arterial blood that nourishes the cells and keeps the collagen elastic. It is literally a localized cardiovascular exercise. You are preventing your own body from shutting down the factory due to lack of use. So think of it as preventive maintenance against atrophy. Benefit number 2, the drainage effect on the prostate. This is undoubtedly the most debated point and the one that causes the most confusion. Let's talk about the famous Harvard University study. For years, people thought saving semen was good. Modern science tells us the opposite. There is a very solid medical theory called the stagnation hypothesis. Imagine the prostate as a gland that constantly produces fluids. If those fluids are not expelled, they accumulate. Over time, these stagnant secretions can become a breeding ground for toxins and inflammation and may even crystallize, forming small stones that irritate the gland. The Harvard study, which followed more than 30,000 men for nearly 2 decades, found something revealing. Men who ejaculated frequently, we're talking an average of 21 times per month, had a significantly lower risk of prostate cancer compared to those who did it rarely. Attention! I am not saying masturbation is a vaccine against cancer, but regular ejaculation acts as a cleaning mechanism, a natural drainage that helps expel potentially carcinogenic agents that accumulate in the prostatic ducts. It is a simple, free, and natural way to care for a gland that tends to cause so many problems after age 50. Benefit number 3, strengthening of the pelvic floor and urinary control. This is a subject very few men talk about because of shame, post-urination dribbling, or mild incontinence. Many men believe Kegel exercises are only for women after childbirth. That is a serious mistake. The pelvic floor is the network of muscles that supports your bladder and intestines. It is also responsible for the strength of your erections. With age, these muscles weaken, leading to those annoying urine leaks or erections that don't stay firm. What does masturbation have to do with this? During arousal, and specifically during the rhythmic contractions of orgasm, your body is performing intense training of these muscles, especially the pubococcygeus muscle. Each contraction is like a repetition at the gym. Keeping this activity going helps preserve muscle tone in this critical area. This not only improves your sex life, but also helps maintain your dignity and hygiene by reducing those urinary problems that so greatly affect quality of life in later years. Benefit number 4, an unexpected boost to your immune system. This benefit will surprise you because it is one of the most recent discoveries in the field of psychoneuroimmunology. It has been found that sexual arousal and orgasm stimulate the production of a substance called secretory immunoglobulin A, IgA. This is a major antibody found in your mucous membranes, nose and throat, and acts as the first line of defense against viruses and bacteria, such as the flu or common cold. Studies have shown that people with an active sex life, and this includes masturbation, have significantly higher levels of IgA than those who are abstinent. Think of it this way: as we age, our immune system slows down. Incorporating this practice is a way to give a small booster to your natural defenses. It's not just pleasure, it's defensive biology working in your favor. Benefit number 5: the most natural analgesic in the world. We have reached the 5th point, and this one is vital if you suffer from chronic pain, something very common after age 60, whether from arthritis, back pain, or tension headaches. Before you run to the medicine cabinet for a pill, you should know that your brain has its own pharmacy. During masturbation and orgasm, the brain releases a cascade of neurochemicals, including endorphins. Endorphins are natural opiates. They have a chemical structure very similar to morphine. These substances block pain signals in the spinal cord. Many patients have told me that after an orgasm, they feel remarkable relief from joint or headache pain. It is temporary relief, yes, but it is 100% natural, with no side effects on your liver or stomach, unlike pharmaceutical painkillers. It is a form of pain self-management that nature has given you as a gift. But wait, because if you think these benefits are impressive, what comes next is even deeper. We're going to talk about how this practice directly affects your brain, your heart, and your mental health in ways you may never have imagined. Let's continue with benefit number 6. We've talked about muscles and circulation, but now I want us to focus on something that governs your entire being, your brain and nervous system. The next 5 benefits are, in my medical opinion, the most powerful reasons to keep this practice active in your later years. Benefit number 6: a shield against stress and cardiovascular protection. We live in a fast-paced world, and even if you're retired, stress doesn't disappear. It just changes form. Financial worries, family health, loneliness, all of this raises your cortisol levels. Cortisol is the silent enemy of the older man. When it's high, it increases blood pressure, damages arteries, and promotes abdominal fat. This is where masturbation acts as a necessary physiological escape valve. Neurological studies show that orgasm works like a reset for your autonomic nervous system. You move from a fight-or-flight state dominated by stress to a parasympathetic state of rest and digestion. By dramatically lowering cortisol after orgasm, you are indirectly protecting your heart. It is not a substitute for your blood pressure medication, of course, but it is a natural complement to keep anxiety under control and your heart beating at a calmer rhythm. Benefit number 7: the chemistry of restorative sleep. How many of you have trouble sleeping? Insomnia is an epidemic among men over 60. Before you reach for sleeping pills that can cause dependency, let's talk about prolactin. Prolactin is a fascinating hormone. It is released in large quantities immediately after male orgasm. We often call it the hormone of satiety, but it also has a very potent sedative effect. It is responsible for that feeling of heaviness and deep relaxation you feel afterward. Unlike medication-induced sleep, which is often not restorative, the sleep facilitated by prolactin and oxytocin is natural and helps your body enter the deep REM phases, where your brain is cleaned and your cells regenerate. Seeing masturbation as a natural hypnotic can turn your nights of tossing and turning into nights of real rest. Benefit number 8: self-exploration as an early diagnosis tool. This point saves lives, and I am not exaggerating. When you masturbate, you are in intimate contact with your anatomy. You know the texture of your skin, the shape of your testicles, and the curvature of your penis. This is vital because it makes you the first detector of problems. I'm talking about early detection of conditions such as Peyronie's disease, an abnormal curvature caused by scar tissue, or small lumps in the testicles that could be cysts or tumors. Many older men ignore their genital organs until there is pain, and sometimes it's too late. By masturbating mindfully, you are performing a self-medical exam. If you notice a change in sensitivity, strange hardness, or a new curvature, you can see a doctor immediately. It is pure empowerment. You are the guardian of your own body. Benefit number 9, ejaculatory control and sexual rehabilitation. There is a myth that premature ejaculation is only a young man's problem. False. Many older men develop control issues or, conversely, difficulty reaching climax due to medications or diabetes. Masturbation offers a safe, private, pressure-free environment to practice what sexual therapy calls the stop-start technique. It is like a gym for your sexual reflexes. Without the anxiety of having to satisfy a partner, you can learn to recognize your body's signals before the point of no return. Training this control on your own gives you immense confidence that, if you have or decide to have a partner in the future, will translate into much more relaxed and satisfying intimacy. Don't see this as a vice. See it as physical therapy for your sexual nervous system. Benefit 10. Neuroplasticity and libido maintenance. Finally, and perhaps most profoundly, your brain is your most important sexual organ. In neurology, we have a saying, "What is not used atrophies." This applies to the neurons responsible for desire and pleasure. If you completely shut down your sexuality, those neural pathways weaken. Your brain assumes that function is no longer needed and redirects resources. By keeping fantasy and physical response active through masturbation, you are exercising neuroplasticity. You are keeping the connections between your mind and your genitals alive and well lubricated. This is crucial not only for sexual health, but for your overall vitality. Feeling desire, feeling pleasure makes you feel alive. It reminds you that, despite the years, your body is still capable of generating joy. And that feeling of vitality is a natural antidepressant that no pharmacy can sell you. So far, everything sounds wonderful, doesn't it? We have seen how this practice can be your ally against cancer, stress, and insomnia. But here comes the critical part of our conversation. It would be irresponsible of me, as a doctor, to send you away with only the positive information. Because the reality is that if you are not careful and ignore certain warning signs, this same practice can become a serious problem. There are specific risks for mature skin, the urinary system, and your psychology that you need to know before continuing. In the next few minutes, we are going to talk about what you should not do and about the alarm signs that require immediate medical attention. Don't leave yet, because this information is what guarantees your safety. As a doctor, my oath is first and foremost to do no harm. That is why I cannot end this video with only the positive aspects. Masturbation in maturity is healthy, yes, but the body of a 60 or 70-year-old man is not the same as that of a 20-year-old. Ignoring this biological reality can bring you serious problems. I want you to listen very carefully to these 4 vital safety points for your physical integrity. Precaution number 1, skin fragility and the need for lubrication. This is the number 1 mistake I see in my office. With age and decreasing testosterone, the skin of the penis becomes thinner, drier, and less elastic. What used to withstand friction when you were young can now easily suffer damage. Dry masturbation, which you may have done without problems in your youth, can now cause microabrasions or small cracks in the skin. These wounds are open doors for bacteria and infections. Healing is also slower in mature skin. My medical advice here is non-negotiable. Use lubricant. Don't see it as an erotic accessory, but as a healthcare product. A good water-based lubricant protects your skin, prevents irritation, and improves sensitivity, allowing you to enjoy yourself without injury. Precaution number 2: the danger of the death grip and Peyronie's disease. As nerve sensitivity decreases with the years, many men tend to apply more force or pressure to feel the same sensation. This is dangerous. Forcing an erection that is not 100% rigid or bending the penis with aggressive movements can cause micro tears in the tunica albuginea, the inner layer of the penis. When these tears heal, they form hard scar tissue. If this accumulates, it can lead to Peyronie's disease, which causes painful curvature and can make future sexual intercourse impossible. Treat your body with gentleness. Masturbation should be a caress, not a battle. If you need to grip very tightly to feel anything, it is better to rest for a few days and let your nerve receptors recover. Precaution number 3: the trap of emotional isolation. Let's talk about mental health. Although we said it relieves stress, there is a fine line between relief and escape. If you find yourself masturbating several times a day compulsively, not out of desire, but to escape feelings of loneliness, depression, or deep boredom, then it is no longer healthy. It becomes a defense mechanism that isolates you even more from the real world. If you feel you prefer masturbation over real social interaction, or if it interferes with your daily life, that is a warning sign. In that case, masturbation is not the problem. It is the symptom of an emotional issue that needs professional attention. Precaution number 4: false security. The most important point, please engrave this in your mind. Masturbation does not replace the doctor. Although we said that frequent ejaculation helps reduce the risk of prostate cancer, it is not a cure and does not make you immune. I have had patients who thought that because they were sexually active, they didn't need routine exams. That is a fatal mistake. If you are over 50 or over 45 with a family history, you need to have your PSA blood test and digital rectal exam every year. If you notice blood in the semen, pain on ejaculation, or drastic changes in erectile function, do not assume it is normal due to age or that it will resolve on its own. Go to a urologist. Masturbation is an ally of health, but preventive medicine is what saves your life. We have come a long way in these minutes. We started talking about fears and silences, and now you hold in your hands the power of scientific knowledge. I want to close this conversation with a personal reflection. We live in a society that unfortunately tends to make older men invisible. We are told that passion, desire, and connection with our own bodies are things we should leave behind, as if they were toys of youth. But medicine and biology tell us something very different. Your sexuality has no expiration date. As long as you are breathing, your body is designed to feel, to respond, and to seek well-being. Masturbation, as we have seen today, is not a shameful act or a sin against your health. On the contrary, when practiced with awareness, moderation, and the precautions I have just given you, it is a formidable ally. It is a guardian of your prostate, a trainer for your heart, and a balm for your mind in a stressful world. So the next time you find yourself in that private moment, I want you to eliminate the guilt. Instead, think that you are performing an act of self-care. You are honoring the incredible biological machine that is your body. Now we have covered the mechanical and physical part, but the other piece of the puzzle, equally critical for your potency and prostate health, and which most men completely ignore, is the fuel. You can have the best engine in the world, but if you put the wrong fuel in it, it will break down. Did you know there are specific foods you have in your kitchen right now that may be destroying your testosterone and inflaming your prostate without you knowing? And on the other hand, Did you know there are natural ingredients that act almost like natural Viagra for your arteries? In my next video, we are not going to talk about exercise. We are going to talk about strategic nutrition for the mature man. I am going to reveal the list of foods you should eliminate today if you want to keep your erections strong and your prostate healthy. You won't want to miss this information because it perfectly complements what we learned today. If this video brought you peace of mind, taught you something new, or simply made you feel understood, I ask for a small favor. Like the video and subscribe to the channel. By doing so, you not only support this work, but also tell the algorithm that this kind of honest, taboo-free information is necessary for more men like you. Share this video with a friend you think needs it. You may be helping to save his health. Remember, take care of your body, respect your time, and never stop learning. Would you like us to work together on the script for the next video about strategic nutrition for the mature man?